Hey y'all, it's Dr. Nick here. Today I want to talk about a really important movement pattern, not just for Spartan races, but for life. It's called the hinge, or anything that incorporates a deadlift. I'm going to get into some of the examples later in the video, but it's one of the most important and everyday movements that we do throughout our lives, which involves, picking up a box, bending over to even tie your shoes, picking up your grandkids, whatever. You do a hinge movement every single day. So it's a really important movement to train. But if you're in pain, some of these progressions may be too difficult to do by themselves. So I gave some examples of where to start, as opposed to just throwing, a bunch of 45s on the barbell and going at it. Because usually doing too much too quickly is one of the main reasons why people get hurt. So try those two. Again, don't forget to like, subscribe, share the video. Helps the channel grow, helps you out, helps me. One of the best ways to teach someone how to do a lift is to incorporate some sort of cue where you know that your butt is going as far back as you can. The simplest way to do this is to use a wall. Using a pipe in front is a great way to reintroduce the deadlift for someone who wants to get back into lifting. Once you're able to go back into the wall, the next progression is to come off the wall. Now I'm using the pipe in a different way here. I'm using the pipe to ensure that my hips are the primary movers of this exercise. Back will definitely get a little bit of work here too, but you should feel most of this in your hips and your hamstrings. One way I like to reincorporate weight into the hinge is to have a knee propped up on a bench, table, or stool. This is a great alternative to a deadlift because it helps a patient incorporate the hinge movement on one side, on the side they may having some trouble with, having some difficulty with the hinge, or having some pain. It's a little lower intensity than the full deadlift seen here. Obviously you want to start with some light weight as you go into the movement. You can also use dumbbells, barbells, kettlebells, anything you like. Start light, take it day by day, that'll build yourself up. Even though I use the stick to keep my back as flat as it can be, that's not gonna happen. All it is a cue to use my hips a little bit more, but you are gonna have to flex your spine to be able to do a deadlift. The research shows that your spine is gonna have to bend a little bit to be able to pull off this lift, and that's totally okay. There's a stigma behind deadlifts that they're harmful or that they're bad for you. That needs to change, because I've been told actually that I shouldn't do deadlifts. Yet there's such an important movement pattern through all walks of life. Again, don't forget to like, subscribe, share the video. It may not help you, but it might help someone you know.